It is a priceless moment when a family of two becomes a family of three. But for one couple in Millinocket, the birth of their first son quickly went from overwhelming joy to a medical mystery.
Newsletter's Caitlin Chana spent time with the Pelletier family, and Caitlin, baby Nathan's illness had doctors scrambling for answers for months.
That's right, Cindy and Pat. It took dozens of pricks for blood work, catheters and MRIs, and doctors still came up with no answers. Nathan was having seizures, crying most of the day and night. He was eventually diagnosed with an extremely rare condition that mainly affects boys. At 37 weeks, Nathan Pelletier entered the world early with 10 fingers and 10 toes, along with a healthy appetite for life.
We were just kind of in our glory with him. He was really funny, kind of goofy.
He stole the hearts of his parents, Katie and Aaron, but within a month, he began regressing developmentally, not bearing weight on his legs or lifting himself up. And there was something else.
I'd go to nurse him and he would just pause. Everything he did, he paused. The milk would pool in his mouth.
Katie says Nathan would make clicking noises as if he was trying to breathe.
And I picked him up and he was completely limp. It was like holding a lifeless child in your hands. It was horrific.
Doctors diagnosed these as absent seizures, where the brain pauses for a short time. He'd stop moving, stop swallowing, even stop breathing.
You're watching your heart outside of your body just be absolutely shattered and picked apart and torn apart. And there's nothing you can do about it.
Doctor appointments, occupational therapy, and neurological meetings became their new routine. At 6 months, Katie noticed a new problem.
And it almost looks like he's bear hugging himself and bending at the waist.
These bizarre cluster of movements where he bends at the waist are known as infantile spasms.
He was then categorized as epileptic. That changed everything. That took the maybe everything's gonna be fine out of the equation.
Oh, honey, I'm sorry.
Each spasm damages the brain, and for Nathan, they come in clusters. Katie says in just one day, he could have as many as 700 seizures. Nathan stopped eating. He stopped smiling, cried all day. Then a glimmer of hope struck. His spasms disappeared, and it looked like Nathan was improving. Until
then one night it all just kind of came crashing down.
It all returned, and this time it was worse.
That's like somebody giving you a death sentence. It's like the world was falling down around us.
There were various medications they could try, but all came with major side effects, from vision loss to bone deterioration.
It was the worst day of my life.
The Pelletiers went to Boston Children's Hospital.
What is that?
A doctor picked up on a unique physical characteristic.
It can be called the kinky-haired syndrome, or it's kind of characterized by coarse hair. And Nathan's always kind of had fluffy hair and kind of crazy eyebrows and kind of shiny, like the hair actually spindles. And so when you see it in the light, it kind of sparkles.
It turns out that's a symptom of a rare illness called Menkes Disease. It's the body's inability to process and absorb copper. The diagnosis was crushing. There is no cure for Menkes.
And it's your first child, it's your only son, and we just found out our son was going to die. Like, he has a terminal illness that there is no cure for. I thought I was going to faint. I was sitting there and I couldn't think, I couldn't talk, I couldn't breathe. There were tears streaming down my face. And, it felt like my heart had just been shattered. And it was in pieces, and every piece of my heart was dying. It was just laying on the floor to die.
Many children live up to 3 years with medical intervention, but most don't live past a year. I went back to visit Nathan when he was about a year old, after he was put on the only known treatment for Menkes, which is an injectable copper therapy.
What you're hoping for is that it'll go through the blood and make its way into the brain and slowly start the degeneration that's occurring in his brain and in his nervous system.
This treatment doesn't promise Nathan's parents any extra time, but for the first time, they're hearing and getting to know Nathan's personality.
He's talking a lot more. He's holding his head more. He's more comfortable.
She gives him a shot twice a day, and Nathan loves telling the world he is a little fighter.
I love you. I love you.
Right now, Nathan seems to be responding well to the injectable copper. Katie opened up to share her family story because she thinks parents of special needs children become isolated. She wants other moms and dads caring for special needs babies to know they're not alone. Pat and Cindy, without a doubt, Nathan will melt your heart.
Caitlin, thank you.